COVID, flu, and now RSV. There's a rise in cases across the Queen City that doctors are warning about because there is no treatment. And if you combine that with COVID and flu, they say it could be deadly. Queen City News reporter Will Lewis joins us now. And Will, this is a pretty alarming study that we have to hear tonight.
Yeah, that's right, Brian, because currently there is no treatment for the virus. Now, children, those with lung complications, and older adults are more at risk for RSV.
Doctors say they've seen an increase in RSV cases, the virus usually attacking in the winter. But in 2021, there was a high number of cases in the summer. And this fall, there is already more children going to the hospital with the virus.
The problem with RSV is it's a respiratory virus that it can inflame the small airways in the lungs and cause infection and inflammation.
Doctors say the elderly and those living in skilled nursing facilities are at risk as well. And if you have other conditions, breathing is more difficult.
We have elderly people in our ICU that have lung infection and they have it from RSV. So that's really what we're dealing with in our hospitals.
Currently, there is no treatment for RSV. And doctors say they are running plenty of tests to make sure patients are not infected with a deadly combination of RSV, the flu, or COVID.
If you were to get two of these at the same time, say COVID or the flu or COVID and an adenovirus, that's not good. Individuals who get two at once or that co-infection are more likely to end up in the ICU and they're more likely to die.
There are enough hospital beds and staff to handle this current surge in sickness, and hospital systems across the area are helping each other as the need arises.
If there's a hospital in the community that's on diversion, meaning they don't have a bed right there for that patient, then we're happy to accept those patients. And so those teams work together. We're not in competition as it pertains to caring for vulnerable people.
Now, doctors do say that an RSV vaccine could be on the market soon, but until then, they say that everyone needs to make sure their immunizations are up to date.